Those findings just published by the Journal of Pediatrics. Joining us to talk more in depth about this is Dr. Mandieh Parizi, lead interpreting physician of the Rose. Good morning to you. Thanks for being here to talk about this. I think anything we can do to try to beat this disease is incredible, so I hope everyone listens up to this. What does this study reveal?
So this study looked at 44,000 women and polled these women about their eating habits during their teenage years, during their high school years. And the study found that women who consumed 28 grams of dietary fiber per day lowered their risk of breast cancer by 24%, premenopausal breast cancer by 24%, and lifetime risk of breast cancer by 14%. And the thinking is that there are studies out there that suggest that higher levels of dietary fiber reduce the amount of circulating estrogen in the body, which is linked to lowering breast cancer, and also increases insulin sensitivity in the body, which is also linked to decreasing the risk of breast cancer.
Okay, so we need to up that fiber. What would be some type of foods that you should consider?
Generally, plant-based diets are encouraged, lots of fruits and vegetables, and there are studies that actually show that countries that have a predominantly plant-based diet have a lower incidence of breast cancer.
Okay, so you just need to maybe even get just a whole list of fiber-dense foods and really consider upping those in your diet.
Yes.
Okay, let's talk about foods to avoid. Is there something that we need to be thinking about that as far as breast cancer is concerned?
In general, there are studies that suggest that high-fat foods are linked to higher incidences of breast cancer. There are studies that also suggest that alcohol, moderate amounts of alcohol, there's a link between that and hormone receptor positive breast cancers. So there are a lot of studies that suggest these dietary links and breast cancer. But as breast imagers, the number one thing that we can really always remember is that the one modality that really saves lives is screening mammography. So for the average risk women, we encourage women to get that screening mammogram starting at the age of 40. And for our younger women, women who have a family history of breast cancer or who have genetic mutations that predispose them to breast cancer, to talk to their clinicians about getting that screening mammogram earlier. And some of the other things that we encourage younger women to be aware of are their annual self-breast exam, their annual clinical breast exam, and their monthly self-breast exam. So it's really a holistic approach: diet, screening modalities, and then also the clinical things that clinicians can do to lower the risk of dying from breast cancer.
And it is so important for us to be an advocate for our own health, isn't it? Like you said, the self-breast exams,
yes.
Something that you do every month. When do you suggest a woman does that? What part of the month is best?
So women should generally start their self-breast exam starting between 20 to 25 years. And it should be once a month, and usually the same time of the month, every month, and 1 week after the menses. So really self-breast exams, there's so many times that women come to us, they feel a lump, and it's that lump that really starts the process, the workup of looking into what that lump could be.
Yes.
Really important in preventing dying from breast cancer.
Early prevention makes such a big deal. So we do prevention, we do early screenings, and hopefully we save lives by doing that. I'm glad you're here to talk about that, Dr. Parizi. Thanks for coming in from the Rose. You do some amazing things in our community.
Thank you so much.
Awareness is such an important part of the puzzle.
Absolutely.
Good to see you here today.
Thank you so much.
Jose.